I have seen such profound anemia. I do not know how these women are walking around. Blood is life. And a lot of times as women, we think about, now I'm gonna sound like I'm talking out of both sides of my mouth, but we think about taking care of our family, we think about taking care of work, and so we minimize our symptoms. I've had patients to tell me, yeah, I'm bleeding through a pad every hour, but I'm working from home, so I can go to the bathroom and change like I need to. Well, just because you can, that doesn't make it right. That doesn't mean that's something that you should be doing.
This is the Luray Journey Podcast on the McKissick Health Podcast Network. I'm Dr. Sherella Cupid, your host. The Luray Journey Podcast is a space for Black women to choose themselves. Welcome back, sisters, sponsors, and supporters of the Luray Journey Podcast. For the 4th season, the theme is transitions. We will continue the sister circle conversations with Black women from different stages of life with various personal, community, and professional roles. The intention of this season is to continue and start conversations on the meanings, experiences, and practices around transitions, such as becoming a mom, shifting careers, and establishing a new lifestyle. Thank you for being a part of the Luray Journey community, because Luray means love is real and eternal. So sis, let's practice love. Hey sis, it's a new month, and I want to be sure to tell you our summer pick because time goes by quickly. Our summer pick is Caught Out There by Dr. Tahira Chloe Mahdi and Christopher A. Brown. I read this book in 2 sittings. It definitely had me cracking up. And also, it made me think about the importance of home, belonging, exploration in order to return to self or remember self, find self, all of the ways in which we explore who we are in the spaces that we occupy as we navigate adulthood. This screenplay is also a platonic comedy, a Platon com, as the authors have stated. And what's more is that this screenplay is currently being produced by the authors to become a hit film coming out this summer. So if you love a book that becomes a movie, a screenplay to film adaptation, so be sure to get your copy by Tahira Chloe Mahdi and Christopher A. Brown. I'm super excited about this pick because the author, my sister doc, Dr. Mahdi, Dr. 99 will be in conversation with us, moderating the talk. So if you also love to be in conversation with multi-hyphenated artists, be sure to go to podcast.mckissickhealth.com and sign up for the Luray Journey newsletter. That way you can get your invitation to the book club, Our Sister Shelf. And if you want to learn more about this sister doc, Dr. Mahdi, you can also check out the 2nd episode of season 3 of the Luray Journey podcast, where I hold conversation with my dear sister doc to explore how she defines love. I'm sure it will give you more insight into how she navigates the space as an artist. I'm pretty sure June will be here faster than you know it. So be sure to grab your copy. So be sure also to support small bookstores by going to bookshop.org. There you can support the bookstores connected to the Luray Journey community, being One Choice or Left on Red. So today we are in conversation with the Dr. Veronica Gillispie-Bell, also known as the Fibroids Queen. So please, Dr. Gillispie-Bell, may you please introduce yourself?
Hi, everyone. I am Dr. Veronica Gillispie-Bell. I'm a board-certified obstetrician and gynecologist. I am an associate professor and the assistant medical director of health outcomes at Ochsner Health in New Orleans, and also the medical director of our state perinatal quality collaborative and our maternal mortality review for the Louisiana Department of Health. And as Sherella said, I am in my clinical practice, I think affectionately known as the Fibroid Queen.
Thank you, Dr. Gillispie-Bell. May you please share what brings you to the Sister Circle space?
So I think that I am always looking for opportunities to educate, to share my experience, my knowledge for those medical conditions that affect women that we don't talk a whole lot about, but especially those that affect Black women disproportionately. I have to say that I went into OBGYN, and I'm sure we'll get into this in the conversation, but to find the cure for fibroids. And along my journey, I have learned that there's one, just a lot that we don't know, but as Black women, there is a lot we do not know. And there's a lot that that we know and is not right. And there's a lot that we've been told that also is not exactly correct. And so I am hoping to use spaces like this to educate, but also to empower. I think knowledge is power. And when you understand, then when you come into the health space, you're equipped with the tools that you need to advocate for yourself and to ask the questions that you need to ask to make sure you're getting the right and the best care.
Thank you for sharing that. So in connecting your mission, your passion, your profession of spreading the word as an expert, planting seeds, if you could name this season of your life, what title would you give it and why?
I think right now I am, not to be redundant, but I feel like I'm in a planting season. I feel like I've definitely gone through a season of harvest and it's been great. I feel like for the things that are happening on the federal level and some things that are happening in the other spaces that I touch, I'm in the process of planting seeds with the understanding that the harvest is not going to come right now, but that's okay. The ground has been plowed, the ground is ready. I'm planting the seeds.
Thank you. So within your season of planting the seeds, how are you defining love?
So I think regardless of the season, I think I define love the same. I think the activities that express love change depending on the season that I'm in. So for me, love is that selfless expression where we're putting others in front of our own needs. So for me, in the time of planting seeds, and in this space, it is sometimes putting myself aside to make sure I'm planting seeds. For example, today is a vacation day for me. I'm off today because my son has his sixth grade soiree and all the kids are coming to my house. So I'm getting the house together and getting food together and all of that. But in my schedule is very busy. And I saw today as an opportunity to set some time aside to be able to do this podcast, to plant those seeds. And so I could be upstairs watching a movie. I could be lounging on the couch. I could be at the spa, but those would be seeds for myself and not for others. And so that is how, I guess, like I said, in this season of planting, that's how I'm expressing love at this moment.
Thank you for speaking with us on your vacation day. We really appreciate it. So as a OBGYN, what led you to this career field?
So I think it's an interesting story, and anybody that's heard me talk about it will also have heard this story before. But so I attended Xavier in New Orleans for undergrad, and I'm originally from Meridian, Mississippi. So I was going home for Christmas break. This is when I was a junior in college. And so at that time, you had to see a gynecologist when you were 18. And so my mom had made an appointment for me to see the family OBGYN in Meridian. And so I go to see Dr. Purvis, and before the appointment, he says, "Oh, I hear you want to be a doctor. What kind of doctor do you want to be?" I said, "Oh, I want to be a pediatrician because I love kids." And he's like, "Yeah, you don't love them when they're crying and when they're vomiting on you. You want to be a pediatrician because you've never seen any other doctor." And he's right. I had never been sick. I hadn't been anywhere but to the pediatrician. He said, "Come back at 5:30. We're going to go do a C-section." So he treated me like a third-year medical student, even though I was a junior in college, for my 2.5 Christmas week break. And I fell in love with OBGYN. I was like, this is amazing. Everybody should want to do this. It's medicine, it's surgery. I get to deliver babies. I get to take care of women. While I am educating my patients, I'm also able to educate myself. I'm able to understand my health better. I get to take care of patients from a continuum of life. It's not just that I'm taking care of them at one point in time. I can take care of them for their entire life, reproductive life and beyond reproduction. And so that is what made me choose a career in OBGYN. And so, when we talk about planting seeds, I am very grateful and very thankful that Dr. Purvis took the time to plant those seeds in me.
Wow, that's an amazing story. Yes, so you uplifted the importance of representation, the fact that you wanted to be a pediatrician because that's all that you saw. So the next question is connected. What does sisterhood look like in this field?
The sisterhood, I think that's a great question. I think there are ways that sisterhood looks in this field, and I think there are ways that it should look in this field. So, when we think about OBGYN, it is women's healthcare. So it in itself is a sisterhood. We are only taking care of women. I don't take care of men. I don't take care of kids. I only take care of women. And so the fact that is who we're providing care for, I think that in itself makes it a sisterhood. But there's also a sisterhood of physicians as well. I am in a space, especially when we start talking about leadership, where I don't see a lot of women. I don't see a lot of women of color. And so there's a sisterhood that I feel a part of, and a sisterhood of support that we have created for ourselves. For Black women in this space. We have a little group text message, which is great, of Black women physician and physician leaders. I have another sisterhood of women physicians in general that we have another little group text message. And so, so I think there's a sisterhood in that way. And then I think there is another sisterhood that I have been a part of, and it may not be in a physical space, but more in a virtual space or a connected space. And that is a sisterhood of being a Black woman, providing care for Black women, and the Black women that I provide care of, and myself, that being a sisterhood as well. For patients that come in to see me in the office, they know we're not just going to talk about whatever their medical problem is that they come in for fibroids. We may talk about fibroids, but we're going to also talk about our kids. We're going to talk about school. We're going to talk about what's going on in the world. We're going to talk about just a number of things. And so I think that holistic approach to medicine in itself creates a sisterhood between me and my patients.
That's beautiful. So within connecting the sisterhood, the holistic care that you uplifted within sisterhood in these multiple spaces that you are in, as an expert in the field, can you please tell us what is the connection between uterine fibroids and Black maternal health?
Yes. So I think, first of all, let's talk about fibroids in general, especially with Black women. So 80% of Black women will have fibroids by the time they're 50. 70% of white women will have fibroids by the time they're 50. So fibroids themselves are very, very common. But with that being said, for Black women, we usually present 5 years younger than our white counterparts. So we have symptoms much younger. We also usually have a higher burden of disease, meaning we have larger fibroids, we have more fibroids. And then when we think about that disparity in how our symptoms present, there are inequities in the care that we receive. So in general, because when we think about just how women's healthcare in general has been devalued, and I would say that from the point that we've not invested in research for conditions that only impact women. So it usually, and education for providers as well. So it usually takes 3 years and 3 providers to get diagnosed with fibroids. So that's for everybody. And then for Black women, sometimes that's even more delayed. And then when it comes to treatment options, we are less likely to be offered minimally invasive treatment options, even when you adjust for age, body mass index, size of fibroids, anemia, all those things. So there is bias in how we are treated and what we are offered as options. How that relates to Black maternal health is in a number of ways. From a clinical standpoint, fibroids don't necessarily cause infertility, or so it's stated. So just because you have fibroids doesn't mean you're going to be infertile. Or if you're infertile, it's not going to be just because of fibroids. It can be other things. However, we do know that if you have a number of fibroids, it can make it, you can increase your risk for miscarriage. You can increase your risk for second trimester loss. You increase your risk for fetal growth restriction, meaning your baby is smaller. You increase the risk of needing a C-section for delivery. And there's a whole list of morbidities that go along with that. You increase the risk of having a preterm birth. So all of those things impact the actual outcomes of the pregnancy. But beyond that, there are things that we see that are related to the care that we receive as Black women in terms of the bias that I was mentioning, that affects how we're delivered, how we are offered options for treating our fibroids. That same bias exists when we're talking about receiving care as Black women in the maternal health space as well.
Thank you. And also, just to back up a little bit, can you share what are uterine fibroids, please?
Yeah, so uterine fibroids are tumors of the uterus. Now, tumors is not to make us get super concerned. A tumor is just a growth of something in a place where it's not supposed to be. So it basically, with uterine fibroids, it is a smooth muscle cell that has really just grown much larger than it should. They are generally benign. There is a cancerous type of fibroids, but it's very rare. It's about 1 in 350,000 people. And so fibroids either start out benign or they start out as cancerous. They don't change from benign over to cancerous. They are the most common cause of hysterectomy, although that's not the only treatment option, but they are the most common cause of hysterectomy. And in general, symptoms are associated symptoms are heavy menstrual bleeding, sometimes pelvic pain, pelvic pressure, pelvic fullness. Sometimes there can be urinary frequency if the fibroids are pressing on the bladder. They can cause painful sex. Because of heavy menstrual bleeding, they can lead to anemia as well.
Thank you for that expansive overview. So within that uterine fibroids, and for those living with uterine fibroids, what recommendations would you provide, whether or not that's dietary, movement, mental wellness? What recommendations would you?
Yeah, so the first thing is to find a community that also is undergoing treatment or experiencing fibroids. There are some really, really great patient-led advocacy groups that I have worked with in the past. The White Dress Project is one, also the Fibroid Foundation, because I think sometimes, because this is something we have not talked about a lot, and it's something we don't really talk about a lot, especially in certain races and ethnicities. And I'm speaking as a Black woman, that this is just not something we've really talked about in our community. It can feel very isolating. You can feel very, very alone in what you're experiencing. And so I would definitely say find a community. Because we have not had a lot of research on fibroids, we don't have a lot of information on treatment options that are not medical options or surgical options. The one thing that we do know that has been shown in literature, in several studies, is that for Black women, we tend to have lower levels of vitamin D. And when you do vitamin D3 replacement, that does reduce the risk of fibroids returning if you've had them removed. It may also help with growth of fibroids as well. Other than that, there's a lot of chatter out there around relaxers, around red meat, around red wine, around caffeine. And we really honestly just don't know. We just don't know if those things are helpful or impactful. I think most important is understand that if you are feeling like something is wrong, and you need a provider that's going to acknowledge that. If you're having heavy periods, you need a provider that's going to check to see if you are anemic. I have seen such profound anemia. I do not know how these women are walking around. Blood is life. And a lot of times as women, we think about, now I'm gonna sound like I'm talking out of both sides of my mouth, but we think about taking care of our family, we think about taking care of work, and so we minimize our symptoms. I've had patients to tell me, yeah, I'm bleeding through a pad every hour, but I'm working from home, so I can go to the bathroom and change like I need to. Well, just because you can, that doesn't make it right. That doesn't mean that's something that you should be doing. So make sure that you're not minimizing your symptoms and that you are speaking up when you go to the doctor's office or your provider's office so that they are giving you the right care. And so because anemia can have a number of effects on different things within the body.
This episode of the Luray Journey podcast is sponsored by Left on Red. Left on Red, founded by Dr. Latasha Ely Kelly, is a specialty bookstore and cultural space rooted in the mission to amplify representation, cultivate perspective, and empower community. With a focus on titles by Black authors and works of African American interests, the curated collection spans a range of genres and lived experiences, alongside thoughtfully selected stationery, keepsakes, and collectibles that reflect Black culture. Left on Red also hosts events, workshops, and programs that connect literature to everyday life, learning, and well-being. As the home of the Millennial Black Professor and TMBP Media, Left on Red expands beyond the page through podcasting, storytelling, and creative media initiatives that honor underrepresented narratives and foster meaningful dialogue. This space exists to serve, support, and shift, offering both inspiration and intention for anyone seeking reflection, knowledge, and community. You can support Left on Red by visiting leftonredbooks.com. Again, that's leftonredbooks.com, or visiting the bookstore in Wichita, Kansas. Again, thank you, Left on Red, for sponsoring the Luray Journey podcast.
Thank you. So within that expression that you said, even though you can be doing it, it doesn't mean that you should be doing it, right? So connected to that sentiment, is there a question that you believe Black women should be asking their gynecologists that they don't often ask?
A question, let's see, they should be asking their gynecologist. I'm going to kind of change it a little bit. I don't know that there's a question that they should be asking. I think there's information they should be given whether or not they are asked. So if your gynecologist is not asking about your flow and about your periods, if you are bleeding through a pad an hour, if you are having to miss work because of your cycles, if you're having to plan your life around your cycle, if you're having to bring a change of clothes, all those things are information that you should be telling your gynecologist that your gynecologist may not ask. Of course, for me, as patients come into the office, most of the time they're coming to see me for a fibroid consult. And so I am asking, and I will start with a question of, are your cycles heavy? And regardless of what the response is, I will say, are you using pads, tampons? Are you using a cup? How often are you changing? So then I can quantify, is it truly heavy or not? Because you don't know. Your cycle is only what your cycle is. You don't know if it's heavy or not. You don't have anything to compare it to. But understand that your gynecologist, because again, we haven't really been educated through our medical system about fibroids and what questions to ask and all those things. They may or may not be asking you the questions, but you understand as a patient what information you should be giving them so that the light bulb goes off so that they can say, oh, wait a minute, that's actually not normal. We need to figure out what's going on.
Thank you for restructuring the question. So we're going to transition to talk about perimenopause and menopause. I'm grateful that in the public sphere, there's been more conversation about perimenopause and menopause. So can you please share what is the difference between perimenopause and menopause?
Yes, absolutely. And yes, who knew it took Halle Berry going to the Capitol to say she was in menopause for us to finally start talking about it. But yeah, so perimenopause and menopause, I'm gonna work backward. Menopause is a whole year with no periods. That's it. So if you are starting to skip cycles, if you are starting to experience hot flashes, starting to experience night sweats, and you're still having periods, you may be in perimenopause. So perimenopause is the time period before you actually go in menopause. During that time, and it can be up to 10 years before you're actually in menopause. So during that time, that's when hormones are starting to change. Estrogen is starting to decrease, it's starting to decline. Because it is starting to decline, that is why you will start to experience hot flashes. You can experience night sweats. You can experience waking up in the middle of the night. So we found that in perimenopause, even if you're not having night sweats, you can have disruption in sleep because your cortisol levels are starting to change because estrogen levels are starting to change. Now, that's not to say for every woman that's skipping cycles, they're in perimenopause, or if you're waking up in the middle of the night that you're in perimenopause. There are other things that can cause those things as well, but those are the typical symptoms that we see for perimenopause. And again, menopause is when you have a whole year with no cycles, an entire 12 months. Any bleeding after that time is considered postmenopausal bleeding, and that is something that needs to be investigated because that can be a sign of a problem. And whether or not you have hot flashes or night sweats, that's really irrelevant. There are women that go into menopause and never have hot flash, they never have a night sweat, they never have vaginal dryness, they never have any symptoms, but that does not mean that they're not in menopause. And then on the flip side, there are women that will have hot flashes and night sweats, and they are still having some cycles, though they may be sporadic. And again, they are in perimenopause. So you can still have those symptoms and you still deserve treatment, even if you're not in menopause.
Thank you. So, in regards to research, I know you uplifted that there is not a lot of research in thinking about uterine fibroids, but in regards to menopause and perimenopause, are there any research that you think that we should be mindful of?
Yes, so let's talk about that. So there was some research, the Women's Health Initiative study that was done and published in the early 2000s. I believe the exact year I think was 2002. This was research that was extremely harmful actually to women and to menopause and menopause care. So what happened in this study is, and I'm going to break the study down in just a second. What happened in the study, they stopped it prematurely. And what made it to the headlines is that hormones are bad. Everybody stop your hormones. Women are dying because of hormone replacement therapy. And so it started a movement that women stopped taking their hormones. Doctors told women to stop taking their hormones. We then, when we went through medical school and residency training, we weren't taught about hormone replacement therapy because the study came out and said hormones are bad. When you go back and you actually look at the study, and this really wasn't done until probably 10 years later, when you go back and you look at the study, the average age of the women in the study was 63 to 65 years old. So that's already a problem because that's not generally who we are initially seeing for menopause therapy. Because those and the women in the study had been in menopause for many years and had no symptoms. So that's not who is taking hormone replacement therapy. So that was a problem with the study. When they went back and broke it down, the women that were 50 to 59 that were in the study, they actually saw a benefit from hormone replacement therapy. For the women that were on estrogen and progesterone, they saw a decreased risk in osteoporosis, which is thinning of the bones. They saw a decreased risk in cardiovascular conditions, diabetes, all of these benefits. Now, what also came out is that the hormones cause breast cancer. What they saw is that for those women that were taking estrogen and progesterone, they had a slight increased risk of breast cancer. 1 in 1,000, one woman out of 1,000 women, which is just a little bit above the general population. So when we look at what is considered an adverse event or a side effect, that doesn't meet the threshold when we talk about it in terms of research. For the women that just took estrogen, they had a decreased risk in osteoporosis, again, cardiovascular conditions, diabetes. They had a decreased risk in cancer. and they had a longer lifespan. So that, but none of that really made it to that even 10 years later didn't make it to the headlines. And so we are now starting to see more research around hormone replacement therapy, understanding menopause better, understanding some of the changes that are happening. Like, for example, we now know that we have estrogen receptors on the brain. So when you're in menopause or perimenopause and you're having brain fogginess, you're not crazy. That is a real thing, because of that decrease in estrogen and the brain receptors the brain having estrogen receptors. So all that to say that we have to be careful when research comes out to make sure it's good research, but we are now starting to see actual legitimate beneficial research in the menopause space.
Thank you. You also uplifted in the beginning of the conversation that Black women often experience disparity in care, whether or not that's from uterine fibroids, maternal health, general reproductive health. Is there a conversation that you believe Black women should be having concerning perimenopause and menopause?
Absolutely, because we go into perimenopause and menopause usually younger than our white counterparts. Our symptoms are more severe and our symptoms last longer. So again, I think it's I kind of was teasing, but I really am grateful that Halle Berry did say that on the Capitol, because now we're having conversations all over the place. One of my colleagues and good girlfriends just published a book on menopause. There are actually several books out there now. And so I think it's the same as what we were discussing around the fibroids. It's about having that community of other women that are experiencing the same symptoms, and so that you know that you're not alone, but also finding good resources, whether that be your provider or some of the books that are out there, but understanding what are good resources, but also having a little grace for your providers, because as I mentioned, they may not know a whole lot about menopause because it really got the treatment options and therapy really got a lot greatly removed from our education because of that study that came out, the Women's Health Initiative study.
Oh, fascinating. So you said it wasn't corrected until a decade later.
That they did like going back and looking and reanalyzing the data, yeah.
So what happened once they reanalyzed the data? Like, what were the consequences of saying, actually, we may not have interpreted the data correctly?
You know, it hasn't had the media push that the first study had. So it's the information that I was just providing around looking at those women that are 50 to 59, also understanding who was in the study and how you can't necessarily extrapolate what a 65-year-old woman who's been in menopause and has no symptoms, that doesn't necessarily apply to the 58-year-old woman that's been in menopause for a year and is having, severe symptoms. And so I think there are conversations that are happening in our professional societies to help start to educate us as providers. The National American, no, it's the NAM, the North American Menopause Society. They obviously are doing a lot around that. We're even having some of the pharmaceutical companies do some of the education. And so the information is coming out, and we are starting to receive some education as healthcare providers, but it hasn't made it to mainstream media like that first study did.
Okay. I guess the sense like how they say like bad news sell, right? So it should be the corrective, right? So you also uplifted the importance of Black women being in community with other Black women, whether or not they're living with uterine fibroids, experiencing menopause. So connected to the concept and the need for community, what would you tell those who are in community with Black women experiencing perimenopause or menopause? How can they help those Black women as they're experiencing menopause? What would you say?
I would say a few things. One, to be able to, if you're going to be in that community, to be transparent about what you're experiencing, what you're feeling. And if you find a great resource or a great provider, share the wealth. Make sure that the other people in your community are aware. Because again, there's a lot of really bad information out there. And so when you find a really good resource, if you find a really good provider that's educated and understands, then that's an opportunity to have your community educated. Even thinking about having that provider, if your community is one that meets either in person or virtually, but having a provider come and speak and do some education, I think it's really about spreading the knowledge.
Thank you. And connected to the upliftment of spreading the knowledge, as a OBGYN, as a women's health expert, is there one suggestion you would offer for Black women when considering wellness through the lifespan?
Yes. It's a whole bunch of stuff I could say around that. First of all, we probably need to think about our wellness a lot younger than we do. And that's in general for, there's a psychology behind that. When you're at a certain age, you believe you're invincible. And, so that's one part of it. There's only a small segment of the population that develops abstract thinking. That's just a normal thing. And so you at 20 years old are not thinking about what your 60-year-old self is going to be. That's just psychology. That's just what it is. So we need to start thinking about our wellness and our future selves a lot younger, making investments in good habits, and that around sleep, around diet, around exercise. Like, you can't wait until you're 40 pounds overweight to start exercising. Like, that's not the thing. Like, you need to exercise when you're young, when you can still eat that McDonald's hamburger and not gain any weight from it. One, you shouldn't be eating that because you need to think about your future self and your arteries. But you need to establish good exercise routines at that time. And then throughout your lifespan, you just have to adjust. I was talking to somebody, not a patient, but she's a colleague. And she was like, well, I want to start working out, and I've heard I need to lift weights because, and that is true, because it's actually lifting weights more than cardio. Cardio is great for your heart, but lifting weights is better for the rest of your body, for your bones, for longevity, like all of those things. And she's like, but I have no idea how to do that. So she's at an older age trying to figure that out. Whereas if you had worked on that as your younger self, then you would just be adjusting, and that would not be something that you're trying to now start a new routine for. It would be a routine that would be incorporated into your lifestyle. And so that's the first thing, is just start thinking about it younger. I think the other thing, as women, we put ourselves especially Black women, we put ourselves on the back burner when it comes to our health. We take care of our husbands, our partners, we take care of our kids, and we don't take care of our own health. And just remember that if you are not here to take care of everybody else, then they're not going to be taken care of. And so you need to prioritize your health as much as you do that of those around you. And then I think just the last thing I would say around that is just having conversations about, fourth thing, there's one more thing I say, having conversations about your health and what you're experiencing with your girlfriends. Like, it doesn't need to be a secret. We have to all talk about it. I have so many patients that tell me, like, once they come in and we've talked about it and they know they have fibroids, they may start mentioning it in a space, either in their family or with their friends. And then they found out 10 other people are going through the same thing. And so it doesn't need to be a secret. And then the real last thing I would say to think about from a wellness standpoint is mental health. One of my friends from college, from when I went to Xavier, Dr. Dawn Brown, who's a psychologist, we were on a panel, and she said this, and it resonated with me so much. We are all on the mental health spectrum. Everybody on the face of the earth is somewhere on the mental health spectrum. And so we have to normalize that it's not okay that it's okay to not be okay. That is, and especially in our community, that just it has not been accepted to talk about mental health illnesses, mental health conditions, about depression. but we are all on the mental health spectrum. So we're all somewhere there. And so we need to normalize mental health so that we can talk about that as well in these same spaces so that we can get help when we need help.
Thank you for those suggestions. Definitely something to sit with. I totally agree. I'm glad that we are shifting the conversation in regards to normalizing mental health because we do live in a society that I would argue doesn't prioritize wellness, right? So you uplifted the point that Black women often put themselves last in regards to their wellness. So, in regards to all of the roles that you have, right? All of your primary roles that you are balancing. What is a reminder to yourself to circle back to feel grounded?
That's a great question. And I actually got a very similar question earlier this week about that. It's hard. It is really, really difficult. I will not say that I have figured out the magic answer because I have not. And of course, as I grow and I mature and I change, I learn different things. And then what I need for grounding changes as well. But I did go through a great course that my health system, Ochsner Health, sent me to that was amazing. And I will, I just think it's funny. I'm going to talk about a little bit about the course. When we walked into the room, there were all these chairs in a circle. They had blankets on them. There was a candle in the middle of the room, and there were boxes of tissue on the floor. And I was like, oh my goodness, what is about to happen? Why am I here? Why are there boxes of tissue? But it was, and we all need the tissue, but it was really, really, it was such a good course. And it was about understanding that this is supposed to be I'm not doing the Delta sign because I am not a Delta. But if we think about like a pyramid, and if we put the pyramid, the base, right, which is our foundation, and if work is at the top of the pyramid and we make our pyramid like this, we don't have anything to stand on. Mm-hmm. And so it was about understanding what is your base? What is your foundation? What are those things? And for me, it's faith, family, and friends. And so making sure that I am always investing in those things. So for me in the morning, I have the Bible app. I read a scripture, listen to the understanding of the scripture. I listen to a sermon while I'm getting ready in the morning so that I can tell people so I can not be a troll for the rest of the day. Like I need that grounding to take me into the day because God knows there's some things that are going to come throughout the day that I need to be prepared for. My spirit needs to be in a good place. And so for me, faith is important. Family is important. Making sure we can't do it every night, but that we sit down as a family and we have dinner time together and we talk about the roses and thorns of the day. What was good about your day? If you said you had a good day, why was it good? What's going on? So that family time is very important. And for me, for friends, making sure that I'm spending that time with my friends, whether that's going out to dinner, that's having an activity, that is saying no to something else so I can spend that time with my friends. But, and I have different friends in different circles and we connect in different ways. And so it's finding time to connect to all of those circles, but understanding that that's the base. And if that base is not okay, then the rest of it's going to fall apart.
That's good. What is your base? Yes, that's a beautiful way of looking at it. Thank you for sharing. So connected to faith, family, and friends, I think this question definitely connects. So this sister circle community is named Luray Journey, with Luray meaning love is real and eternal. What is your understanding of love being real and eternal?
So that's a very thought-provoking question. So in terms of love being real, I have to go back to my definition of what love is for me. And so for me, real love is when I see that selflessness, whether that be in the form of, like we were talking about in the beginning, my love language is gifts. So whether that selflessness being in the way of gifts, that selflessness being in the way of how people spend their time, that is to me real love. And I am, it's interesting because my husband's, his love language is words of affirmation. And for me, that is like at the bottom, words of the bottom, because I feel like you can say whatever you want to say. It's what you do that matters. And so for me, it's the what you are doing to express and to show love, and not exactly what you're saying. So that's the real part for me. And the eternal part is, for me, it's back to my faith. Is back to faith, and thinking about, and again, applying that definition of love. For me, I'm a Christian, and so for me as a Christian, our Christian belief that God was so selfless that he gave his only son so that we could have eternal life. And so for me, that is the epitome of love. That's the selflessness. That is the eternal part that is a part of Lorraine.
Thank you. I appreciate that. So, Dr. Veronica Gillispie-Bell, where can folks find you in the public space? So, do you have any social media handles? Where can folks find you publicly?
I have it all. Well, I don't have it all. I don't have it all, and I no longer am on Twitter. But that's a whole other thing, or whatever the name is called now. X, whatever. I'm on Instagram. V Gillespie 1908 is my IG handle. I'm on LinkedIn just by my name. I have a website, drveronicamedicalmedia.com, where I have different postings, different blogs. I have ways that you can book me as a speaker. You can see some of the other speaking engagements I've had. And yeah, I think those are the primary ways to get in touch with me.
Thank you. You uplifted that folks can find how to book you on your website as a speaker. Are there any additional services that you provide, or any projects that you're working on that you would like to share?
Oh boy, more than we have time for. So on my clinical side, I do take care of women who have heavy menstrual bleeding, pelvic pain, fibroids, and so you can definitely find me through Ochsner.org to book an appointment with me. It may be a little bit of a wait, but I'm gonna still see you. Get on the waiting list. It works because when people cancel, you get bumped up to the top. But for clinical care, that's the best way to get in touch with me. In terms of projects and things that I'm working on, there's, like I said, there's a number of things. Definitely a gazillion speaking engagements and places to hear me speak about a number of issues: fibroids, maternal health, telehealth, health equity, academics, all of those things. I'm on the Xavier Ochsner, the board for the Xavier Ochsner College of Medicine. So we are forming a medical school between Xavier and Ochsner. And so speaking about that in places, as I mentioned, am the medical director of our state perinatal quality collaborative. With that, we're working with our birthing facilities across the state to implement evidence-based practices to improve our maternal outcomes. If you want to know more about that work, you can find us at lapqc.org. And then also, as I mentioned, I run our maternal mortality review committee, and we put out a report annually. Our next report for our 2021 data should be out in the next few months, and you can just find us at Partners for Family Health through the Louisiana Department of Health, and that's where the report will go once it's published. And there you can see our previous years of reports. And again, there's a gazillion other things, but those are some of the more visible things that I want to uplift to make sure that the public is aware. Those are things that are happening and resources for them.
Thank you for sharing those places to find the research. So thank you again, Dr. Veronica Gillispie-Bell, for sharing your experiences and reflections on love and transition during this season. Thank you, sisters, supporters, and sponsors for listening. Be sure to join the community by following the podcast across social media, including YouTube, Spotify, Instagram, and TikTok, with the handle @LorraineJourney on all your favorite devices. Also, be sure to sign up for the newsletter at podcast.mckissichealth.com. And as always, love is real and eternal. In community, peace.
Hey, Luray Journey community supporter. You can follow the community by following the handle at Luray Journey on Instagram, TikTok, and YouTube. Also, be sure to leave comments on Spotify, YouTube, and follow wherever you're listening or watching the podcast. For those who are part of the book club or love to discuss books and movies, you can follow me at Sherella Cupid on the Fable app. Lastly, you can go to podcast.mckizikhealth.com to sign up for the newsletter. There, you'll receive updates such as new episode drops, events, and so much more. Again, go to podcast.mckizikhealth.com. And as always, love is real and eternal. In community, peace.